Present. David Thorne.
Katie Dunn. Kathy Swearingen.
Liam Learsham.
Francesca Lanave.
Dominic Hastings-Baker.
Simon Noyes.
The paper, The Image, Mentalization and Group Art Psychotherapy by M. Franks and R. Whittaker. In the introduction, they introduce their purpose of the paper is an attempt to understand how the process of making images in the group art psychotherapy contribute to positive outcomes achieved in working with small groups with clients with personality disorder. They do ask questions, but they go on to define what personality disorder is and how it's understood.
They're using a combined model of joint work, so it's using art therapy alongside individual verbal therapy and individual group therapy.
Move on to the section under mentalization, where they describe mentalization and also mentalization-based therapy as developed through the Hallowig.
It says, in our art of psychotherapy work, we have realized how the image becomes central in the mentalization process and how it enables clients to observe their sense of self emerging along with the others perceiving them as thinking and feeling. And that is consistent with Guidelines 4, which promotes art as a central focus of art therapy, etc.
We also thought that in the context of describing their practice, their work, that it links with Guideline 1, which in part states the psychological therapy approach used in art therapy should be an evidence-based model and shared by the treating team. Following on in the paper, our model would be a combined approach of individual verbal psychotherapy and group art psychotherapy, a variation on the traditional treatment of choice for personality disorder of individual and group therapy. And we link this to Guidelines 1 and 2, which talk about having an evidence-based and shared model by the treatment team and ensuring an active liaison with the treatment team.
So, also on page 6.
Statement that regular liaison and feedback between individual and group therapists occurred once weekly, which links to Guideline 3.
So ensures the active liaison with treatment teams to deliver coherent care packages. Okay.
The paper states, we introduce the group, underlining the boundaries and structure. We explain that there will be a short space for business at the beginning of each group, followed by 2 further sections, individual art making, then verbal group interaction. This supports Statement 9, actively ensures communication is comprehensible to the service user.
I was looking at the paper, paragraph before mentalizing within the group and image. The line, our response could be understood to transfer it entry. We wondered whether she was articulating a fear she might have about attending the group. I was wondering if it did link in with Guideline 8, the therapists offer their genuine responses to artwork and events in therapy in the service of the therapeutic communication. Although it's not clear whether they sort of made it explicit. Do you have thoughts about Guideline 8?
A question arises about the use of the term genuine in relation to therapist response. But the question being whether that explicitly informs a reader as to what genuine means in the context of these guidelines.
Particularly when looking at text, I think. So when we're trying to understand text, and whether there's a genuine response from the therapist or not, what would inform that reading of the text?
I find that Guideline 9 works best and it becomes a little clearer if we look at in conjunction with Guideline 4. What he says, promotes art as central focus of therapy being an externalization of different states of mind. That, by extension, would imply that, for example, this is what I found in direct observation in our therapy groups, that the same image has got different readings and different meanings, as they are carriers for meaning rather than of meaning. And so different people's view of the same image may actually highlight different views of the patient that has made them, the state of the group, the here and now relationship. So, to allow actively people to collaborate in viewing images together without actually necessarily giving privilege to the opinion of the image maker, but actually to hear the consensus, the collective viewing, may actually actively may then feed into a genuine response to the artwork, because at that point you're not expecting the client to give an account, a verbal account of something that they have actually just produced, but you are asking the group to help each individual, each one of them, think through the image. So I think these two guidelines work well together, and the bit in the paper that would seem to be connected with that, at the beginning of page 8, or beginning, where it talks about how the group's attention has moved from the patient as a person to the artwork, and backwards and forwards. Now, I don't know whether this was that successful, but that sort of backwards and forwards and that kind of collective and viewing joint, in my opinion, is a technique that we should employ and would reinforce, go and feed on the backline, that guideline. Sorry, I'm getting it. Sorry, I've gone around the houses because I have no economical way of explaining this.
I think you're coming to your, what started your statements there was looking at the idea of a genuine response and then working it with the group. For me, that also connects with guideline 7, because then that's about facilitating joint viewing.
Quite right. Quite right.
Those are the two that come together for me.
Yes.
You said.
That's right. You're quite right. That's right. It's 3 of them that work very well together. So maybe they're interactive with guidelines.
Yeah, I found that a lot.
Yeah.
When a piece of text stood out at me, it often related to a couple of guidelines, particularly the clinical ones.